The first question is, among all the specialties in the field of pharmacy, you have chosen clinical. Now, based from your own experience, is clinical pharmacy right for you? Or would you have wished to have worked in a different specialty in the field of pharmacy?
Yes, clinical pharmacy is right for me because it promotes the welfare of the patient, especially on the rational use of medicine or the drug. And then, aside from clinical pharmacy, I also want to practice other fields of pharmacy because based from my personality, I want to become more versatile. So not just in clinical pharmacy, not just in the academy, but I also want to try other discipline. For example, in the research that will focus on more on the safety of the patient, for example, and also the safety of rational use of drug.
So, what are the academic and other requirements for this profession?
So basically, after you graduate BS Pharmacy, you should have your license. Basically, that's the minimum requirement here in the Philippines.
So, aside from academics, what are the qualities required of a clinical pharmacist? And what specific skills are needed to perform the job?
Qualities, as far as the qualities is concerned, so you should be more focused on the possible scenario. Like for instance, some of the nurses or some of the physicians might omit a certain error as far as the prescribing error is concerned. So you should be more vigilant with regards on how you prevent such error. With regards to the specific skills, we have some duties and responsibilities as a clinical pharmacist. So we try to check the correctness of the drug prescribed by the doctors or by the physician. At the same time, we try to check any incompatibilities, any drug-drug interactions. So with regards to this matter, so we have to become more decisive as far as the medicine-related or drug-related issues are concerned.
So, can you kindly describe to us the nature of your work in terms of responsibility and role in the field of pharmacy and medicine?
As a clinical pharmacist, unlike in other practice of pharmacy, so we are inclined in patient interaction. We are also try to talk with the physicians and with the nurses on how to deliver the correct dose of the drug. So basically, that is the essence of doing job under the clinical pharmacy program. In the role of the field of medicine, so if you have an experience as a clinical pharmacist, since we are dealing with the patient, so basically if you will pursue your career in medicine, you want to become a medicine student, so it will be easy for you to deal with this patient since you already have an experience as a clinical pharmacist.
Okay. Based from your experience, what are the advantages and disadvantages of being a clinical pharmacist? And what is the best and worst thing about clinical pharmacy?
Advantage, we are more inclined in the recent knowledge or the recent development in the drug. So that is one of the advantage of being a clinical pharmacist because you actually see the drug itself as is. Okay? More on the actual scenario. But the disadvantage is it will depend in a nursing unit that will occupy a large bed capacity, so that will be a burden on your part. So you might have any stress-related sickness or illness because of the, let's say, you might assign in a graveyard shift, something like that. So that is the disadvantage, and most probably the worst thing about clinical pharmacy.
So, describe a typical day for a clinical pharmacist.
Interaction with the patient, we do the patient counseling, we visited the room of the patient, and we have interaction with the nurses, with the doctor. So there's a camaraderie among the allied health professionals and at the same time patient as well.
Are there any perks of being a clinical pharmacy?
In St. Luke's, one of the perks is we have an interaction with the celebrity, something like that, and then that's it. I think that's one of the perks based on my experience.
What makes clinical pharmacy distinct from the rest of the field in pharmacy?
Distinct in such a way that the importance of the pharmacy is there. Okay. Although the importance as a pharmacy in the community is also seen in our society, but if you will work in a hospital and you want to check the patient through the patient chart and you want to visit them, so there's a feel that you are really the part of the allied healthcare team. So that is I think an idea that would be distinct from other disciplines of pharmacy.
What advice would you have wished to receive while you were still a student that would apply to your profession now?
Do not surrender. Yun lang naman. Do not surrender and try to do the right thing always, because at the end of the day, there's still a good karma. So right after your hard work and your good deeds, so you will receive something coming from you. So also be thankful since you are studying university. That's it.
The last question is, would you suggest clinical pharmacy as a specialization for future pharmacists? And what advice can you give?
Yes, clinical pharmacy is a more lucrative field in terms of pharmacy practice, because if you will become a dispensing pharmacist, although I'm not saying that dispensing pharmacist is not good, but maybe in the near future, let's say 50 years from now, so the pharmacist working in the community pharmacy might be replaced by certain robotics or technology that would dispense medication. So we might displace from the community pharmacy. So what will be our edge? So you have to gain more knowledge with regards to on how to give an appropriate dose to the patient. So we have different courses under pharmacy. So let's say clinical pharmacy, pharmacology, public health, and if you want to pursue clinical pharmacy program, so they have disease management courses, clinical pharmacy too. So these things are very essential if you want to pursue your practice, not just as a clinical pharmacist but also other fields of pharmacy as well.